Through innovation, academic excellence, and family-centered clinical care, Children's Mercy Kansas City is transforming outcomes for children around the world. Welcome to the audio interview series, Transformational Pediatrics, with host Dr. Michael Smith.
So our topic today is identifying novel drug treatment options for osteosarcoma. My guest is Dr. Tomu Iwakuma. Dr. Iwakuma is the Director of Translational Laboratory Oncology Research at Children's Mercy. Dr. Iwakuma, welcome to the show.
Well, thank you very much.
So I know you were involved in an important research study. Why don't you tell us a little bit about that study and what prompted you to do this?
Sure. So this research is first supported by the Braden's Hope and then related to the novel therapeutic compounds that can specifically kill the cancer cell, which in this case is osteosarcoma cells, lacking the most frequently mutated human gene called P53, tumor suppressor P53.
And so this study was specifically looking for any multiple compounds that might be able to achieve your goals. Is that correct?
Correct. So the why I've been doing the osteosarcoma is I am originally orthopedic surgeon in Japan. Then I have a clinical practice by treating the patient with the osteosarcoma. The current therapeutic modality has a limitation, and in the end, aggressive osteosarcoma, you have no treatment option. So nothing you can offer to the patient. I really don't like that.
Right.
So I want to discover the novel strategy or novel compound, novel drug that can kill the cancer cells, especially in my case, osteosarcoma. That is most frequent type of bone cancer, by the way.
So when you were going into this research, when you decided that this was something you wanted to study, did you already have in mind some compounds that might be able to work in this specific case of osteosarcoma, or?
That is a great question. Actually, this research initially started with Midwest Cancer Alliance collaboration with the medical doctor, hematology oncology doctor, Dr. Joy Fulbright in Children's Mercy. And then we wanted to find out a compound that specifically kills osteosarcoma cells, both canine and human osteosarcoma cells, but doesn't kill the normal non-tumor cells. So to do that, we started the live chemical library screening, basically compound library screening. This library contains many unknown and known, including FDA-approved compounds. So then we just did this or a live screening. Then we identify many of the potential candidates, which only kill the canine and human osteosarcoma cells, but does not kill the non-tumor cells. That is in collaboration with High Throughput Screening Core Facility in KU.
Once you were able to identify, I guess from that initial research, looking into that library of compounds, how many compounds are we talking about that you initially were looking at, and how many were you able to identify as candidates?
150, over 150,000 compounds we start with.
Wow.
So then
that's
we
a lot
end
of work.
up to the right, a lot of work, and I have to give a credit to the High Throughput Core Facility, and then we pick up 176 compounds as candidate.
Wow, 176 out of the 150,000.
Correct.
Where are you at with these 176 compounds? What's the next step to?
So many validation procedure, and we narrow down one compound. It's called a KU compound.
So you've identified, out of that initial 150,000 compounds, you've identified the KU compound. This is the one that is going to give what you believe to be the best therapeutic outcome.
Yes, there's a great potential, I would say. So we confirm this KU compound only kills the cancer cells, but doesn't kill the normal cells. So eventually, we expand multiple osteosarcoma cells, cell lines available. Then turns out this compound has only killed a certain population of the osteosarcoma cells. Even osteosarcoma cells, if this osteosarcoma cells carries a wild type p53, this compound doesn't kill.
Ah, okay.
So normal cell always have a wild type p53.
Right.
Most of the time. So that's why it didn't kill. But even osteosarcoma cells, which has the wild type 53, this compound doesn't kill it. But
right.
if cell lacks the wild type 53, this compound kill it. So this means this compound is cancer specific. That is the most important part. Our body has wild type 53, intact p53. Only cancer lose the wild type p53 activity. Right?
Right. So this is a very highly specific targeted therapy that, at least that's the potential.
Right. Exactly. So then, it's what is ideal. If you think about what is the ideal chemotherapy drug, current chemotherapy drug kill both normal cells and cancer cells. But this drug are expected to only kill the cancer cells, lacking p53 activity. While normal cells have the intact p53, that's why it doesn't kill. Does that make sense?
Yes, absolutely. So what you have found, or at least the potential compound, the KU compound, is one that is going to be very therapeutic, very efficacious, yet at the same time going to keep side effects down, right? The toxicity is going to be lower with this compound.
Side effect is a keyword, yes.
Yeah, that's exciting news.
Now, it is exciting. And then I'm very excited about this, by the way. So what important things is how often cancer cells or osteosarcoma cells lose the p53 activity. So recent genome-wide sequencing result, not our group's result, but other groups, shows that almost over 85% of osteosarcoma have some abnormalities in the tumor suppressor p53 gene.
Mm-hmm.
85%. That's
85%. Yeah. Okay. Which is good. Which means that gives you a large potential patient population you're going to be able to treat. Yeah. That's great.
So, moreover, generally, as I said, p53 is the most frequently mutated gene in human cancer. So over 50% of human cancer lose the p53 activity.
Yeah.
So
that's all cancer. That 50% is all cancer. Yeah.
All cancer, even all cancer, 50%. So you would expect half of the patient to have benefit from this.
Right. I can see why you're so excited.
Yep.
Yeah.
So, even this drug, this compound, could work for the other type of cancer.
Right.
As a part of my study, I checked other type of cancer, head and neck cancer and liver cancer and colon cancer. It's like that. If the cell have a wild type 53, it's very hard to kill. But if cell lose the wild type 53, that becomes sensitive.
Right. Very nice.
It doesn't select the type of cancer.
So, Dr. Iwakuma, let me ask you this then. Obviously, this is still at, you're at the very basic science research phase of this. What's your hope now? This sounds like something we need to move into some clinical trials. Wait, what do you see here? Give us your vision.
Yes. So, this Braden's hope, it really support our research to bring this compound to the clinical trial. So then we checked whether this compound have any stability, solubility, and efficacy in cells or even in bodies. So we found this compound, unfortunately, it metabolizes very quick in the human body.
Okay.
So we understand which part of the structure, chemical structure, we need to modify. We know it now. We learned it.
Okay.
We know where is the breaking point. Where is the breaking point? Where we need to modify. We know that.
Okay. And that's then going to help with the bioavailability of the KU compound.
Exactly. It's going to help the bioavailability. It will be much more stable in our body and keep killing the cancer. That's our hope.
Yeah. So Dr. Iwakuma,
yes.
Let me ask you. This is very exciting work, right? This is fascinating to me, and I'm glad that we've had a chance to talk. What has some of this been published yet or presented?
No. We kind of briefly presented in the last year's American Cancer Society Research Society (AACR).
Is there plans to publish?
Oh yes.
Yeah, I'm sure there should be, right? You're very excited about this. This is a great finding.
Right, and I want to know why this drug only kills the p53 lacking cells, cancer cells.
Yeah, interesting question, right?
Right, why not killing the wild type p53 cells?
Yeah, that's very intriguing, and I look forward, Dr. Iwakuma, to follow your research and see where this goes. Yeah.
Yep. We do have some preliminary data. We have some idea, but once we confirm the mechanism of action, and we will publish probably in a year or so.
That sounds fantastic. Dr. Iwakuma, I want to thank you for the work that you're doing at Children's Mercy. This is very impressive. I look forward to reading your publication on the KU compound, and I want to thank you for coming on the show today. You're listening to Transformational Pediatrics with Children's Mercy Kansas City. For more information, you go to childrensmercy.org. That's childrensmercy.org. I'm Dr. Mike Smith. Thanks for listening.